Great, welcome back. This is part 2 of chapter 1, and we go into this concept of homeostasis, probably the most difficult concept of chapter 1, and it is very much important that you have a good foundation in what homeostasis is throughout your entire study of the body, the whole 2 semesters of 141 and 142. Because homeostasis is something that the body is constantly doing. It's constantly reevaluating what's going on, whether that be intrinsically or extrinsically. So whether it be in a cell-to-cell environment, or whether that is something that where the brain is coordinating and talking with a system like the heart, so heart rate, or a group of systems like the heart, kidney, and also actually the respiratory system to control not only blood pressure, and the respiratory system has a small piece in that, but mostly the cardiovascular system and the urinary system to control blood pressure as well as other major processes. So homeostasis is defined as a state of equilibrium, so a state of constant maintenance of balance. And if you're somebody who's in the gym and you are ever on a balance on what's known as one of those balance boards, it's like you're constantly readjusting from one foot to the other to make sure you stay balanced. And that's what happens with the body. You have opposing forces generally with regard to aspects of homeostasis, and then you have external forces in terms of homeostasis. So it's dynamic, and you are continually, or you are unbeknownst to you for the most part, and sometimes beknownst to you. So sometimes it's conscious, sometimes unconscious, most of the time unconscious. It's a continual adaptation. Now, this is a pretty classic picture of homeostasis where you have the control center. The control center is otherwise known as your brain. And the control center of a human being has certain set points. And that's where we use this analysis of a thermostat. So you set your thermostat, if you're, you set your thermostat, say, at 70. And if it's the summertime, if the temperature, the ambient temperature goes to 71, that would cause the AC to come on, your air conditioning to come on. If it's winter time and the ambient temperature drops down to 69, that would cause your heat to come on. So the control center is where what is to be maintained in homeostasis is set. If it's something like the body, we have a certain pH of the blood, we have a certain level of oxygen that we need to have, the brain needs to have, we have the idea that we get hungry, we get full. These are all set points that we have because we're human beings. Now, the way this is regulated is the thermostat will get information. So the control center gets information from the environment. You as your brain get information via the body, and that information is processed in the brain, and then a directive is sent out to the appropriate system or part of the body that can do something about it. An example would be that the receptors in your skin pick up that it's cold, that you are cold. You're in an environment that's cold. That information is picked up by the receptors in the skin, sent to the brain. The brain would send a message to the muscular system. It's time to start shivering, we need to warm up. And then presumably, at least for a short term, homeostasis would be restored in terms of your core body temperature. So homeostasis is something that you study now. You have a couple of other tools to study homeostasis. You have a video that I have on and also your tough topic, which is a nice thing to listen to if you're having problems grasping this idea of homeostasis. Homeostasis is regulated in 2 different ways, through negative feedback and positive feedback. And what happens, that entire same process goes on, that you have the control center that receives information via the receptor, and that information that comes via the receptor is something is affecting homeostasis. So something is going on in the body or externally or internally that is putting that particular system out of homeostasis. And the brain will then send via the effectors, or the pathway away from the brain, will send a message to negate that stimulus that is putting you out of homeostasis, and then homeostasis will be restored. That's what we call a negative feedback. With negative feedback, and most of your feedback is negative, where a problem is detected via the sensory your sensory system of your body, the brain processes that problem and says, I've got a solution. I'll send the solution out the pathway of the effector. Effector can be glandular or it can be muscle. And that process that the brain decides is the answer then brings you back into homeostasis. That's negative feedback. Positive feedback actually makes the stimulus more exaggerated or stronger. And positive feedback, you have a stimulus come to the brain from the receptor, and the brain says, oh, I know what this is, and what we need to do is amplify it. And so what will happen is the brain will send a message via the effector again that actually amplifies the process. And certainly blood clotting is one, because we do not want to bleed. We actually can bleed to death, and that ultimately is the goal of homeostasis, is to keep us alive. And the amplification would be until blood stops, and then of course you would go in and stop that process. The other one is childbirth, where you have the contractions of the uterus, and those contractions become stronger and closer together until a major process changes the entire dynamic, and that process is the childbirth. That's positive feedback in terms of homeostasis. Then shifting gears here in our topic, we have terms to know and to study, and they tend to be very, very useful with regard to flashcards or just over and over again. Superficial anatomy, near the surface, anatomical position, we talked about this in lab, or you've probably talked about it in other classes. The quadrants, in terms of the abdominal pelvic area, because there's so many organs in that area, we do like to make the body in smaller and smaller pieces to be able to talk about those. So you have abdominal pelvic quadrants and also abdominal pelvic regions. In terms of the anatomical terms, they're excellent to get to know. Some of them are very intuitive, like frontal or nasal or nose, meaning the word is very similar. Others are not so intuitive, cervical or neck, mental or chin. So they are a matter of repeating them, and this image and the next one is they're both very useful with regard to putting that word together with where you find it in the body, and that's more you just hanging out with this particular image and getting this information in your head to help you to understand and comprehend what you're reading going forward. Also to talk to other people who are in the healthcare field. So anterior and posterior anatomical terms. Here you have your quadrants, right upper, left upper, right lower, left lower. And again, what it's doing is dividing a very complicated area of the body into smaller regions so that one can talk about that particular region and be a little more specific about what is found there, or what pain is there, or what pain gets referred there. And same is true with the with the quadrants and the regions both, the regions just tend to be, there's 9 of them as opposed to 4, and they're not as intuitively named. They were when we were speaking Latin, so right hypochondriac region. The hypo is just below the rib cage, chondriac rib cage. Left, right and left, lumbar. In the posterior aspect of the body, that is where the lumbar vertebrae are, and then inguinal and umbilical, gastric. So above the gastric or epigastric, umbilical, and hypogastric, the regions. You have relationships between the quadrants and the regions, and this particular image is useful because is probably one of the better ones to look at, because then you see how these abdominal pelvic organs lie within these not only quadrants but also the regions. Anatomical planes or directions are based on the patient. So you have closer, and the patient, we divide the patient into the midline. So we drop a plumb line right down the middle of a person's forehead, nose, through the mediastinum, all the way down, and proximal would be closer to the midline, distal further from the midline, and these are 2 points in relationship to each other. You have lateral, medial, again, 2 points in relationship to each other. You have posterior, anterior. You have posterior having an AKA, and it's one of the favorite things of A&P to do is to have AKAs. So posterior, AKA dorsal, anterior, AKA ventral, cranial, AKA cephalic, and then caudal toward the tail. So they're just other ways to talk about body parts. And some specializations like one term over another, and then the other thing is some terms are more modern than others. So some you'll hear all of these terms used, some more so than the others. And then planes, and this might be the last thing we talk about on this particular 15 minutes goes by really fast. In terms of planes, you have your frontal or coronal plane, and this is a great picture. All these pictures come from your textbook. And a frontal or coronal plane divides the body into anterior, posterior. You have a sagittal plane, which can be mid-sagittal or any of the sagittal planes, which divide the body into left and right, and transverse, which divides the body into upper and lower, or superior and inferior. And each of these are used for imaging. So you have a CAT scan, an MRI, a PET scan, and what happens is with that imaging, you divide the body into these planes that will help the specialist or the doctor or the healthcare worker see what's going on inside the body. So this is something that's beyond gross anatomy and even closer to microscopic, in the fact that with gross anatomy, if we want to see what's inside an organ, we actually have to take that organ out and cut it apart. And this will image that concept, will image that ability to see inside the body. But one needs to know what the plane is and where you are in that particular relationship of planes, or those slices of the body, to see what you're looking at and what aspect of that organ might be affected by disease or whatever process that is being studied. The last thing, I will pick this up again. Sorry to do this. I think we only have a couple more slides left, but we will pick up on this with regard to the cavities in the third part, and that will be the last part of chapter 1.